honestly, I am one Nigerian that is very happy about COVID. Reason, it made us to stay back in Nigeria and die. Those of us that were supposed to help in funding healthcare services and we didn't fund it, it stared us in the face. I had COVID. I stayed in Nigeria. Luckily, I survived it. So those that couldn't survive, you see, a time comes when you cannot run away from your country. So it's not as if I'm happy that those people died, but it's just that it taught us a lesson that we must put our house in order, because as we lay our bed, so must we also lie on that bed. So that COVID was just an eye-opener. And I want to believe that more sinister healthcare problems will still come, that will still require the fact that we put our healthcare services in order. The other thing is we need to retain our human resources. I am a medical doctor, and I remember when I used to practice, I have done surgeries with lantern. I have done surgeries with candles. I've done surgeries with torchlight, and a lot of Nigerian doctors are doing that today. So it's not as if we are in having scarcity of professionals. If you go abroad, you find out that 7 or 6 out of every 10 doctors practicing abroad are Nigerians. But one of the reasons why they are leaving is that the healthcare system is not properly organized to be able to retain those human resources for health. And so we need to make laws. We need to review the laws to make sure that these people stay back in this country and give our people the much needed attention and the treatment.
Thank you.
The first legislative intervention was actually to bring the National Health Act into the front burner, and thank God it was signed into law, because what we are trying to achieve as legislators is that we need to achieve at least a minimum of 15%, which is the standard that is supposed to, every country is supposed to contribute from the budget to fund healthcare services. And like you said, and we all know, they say health is wealth. Anybody that is not healthy cannot work and cannot make money. So any country that is not healthy cannot also produce. You can see what has happened during the coronavirus time. Everywhere was shut down because of health issues. Now, the National Health Act, which was signed into law, we have discovered that there are gaps. And it is those gaps that we are here to see how we can review and amend. So that, for example, the National Health Insurance is part of the Act, and that is one area that is supposed to have been so beneficial to everybody, the physically challenged, the youths, the elderly, everybody. But that aspect is so fundamentally low in terms of implementation. So that's the reason we are here to review the Act. Apart from that, we also have issues where we have a lot of capital flight. People go to India to go for healthcare services. But you see, I have been to India, and what I discovered is that the Indian health services is not even better than Nigerian health services. But the only difference is that those healthcare provided by Indians are purely private, and they are very, very expensive. And you can imagine how much leaves Nigeria to India. So we are trying to see how we can review this to be able to stop this capital flight, and so that these monies can now be used to fund and service the healthcare system in Nigeria. You are aware that, I don't know how much, but they said over how many trillions, maybe 3 was spent during the COVID time. Now, if we had a good standardized healthcare services, we wouldn't have needed to spend that kind of money on healthcare services, if at all it was spent. So the truth is that we need to put our acts in order. We need to put our houses right. Honestly,